Hello everyone, myself Vinoli, working as a tutor in Tribulum College of Nursing. Today I'm back with another lesson, cardiac catheterization. Let's get on to the video. Let's see the overview of the topics. The first one is introductions about the cardiac catheterization and purpose, indication, contraindication, and sterile field technique which is involved in the cardiac catheterization, and medications used, atrial puncture, steps to insert the catheter, and catheter placement, nursing care which is involved in the pre-op procedures and during the procedures and after the nursing care, and the complications, and finally coming to the conclusion. Introduction. What is cardiac catheterization? Cardiac catheterization is one of the invasive procedures which is used to visualize the heart chambers and valves and great vessels in order to diagnose and treat the disease related to abnormalities of the coronary arteries. How this procedure involves inserting a long flexible and radioplique catheter into a peripheral vein or peripheral artery and the guiding it under the fluoroscopy which is called X-ray observation or angiography. What are the purpose we are doing the cardiac catheterization? To visualizing the chamber pressure, oxygen saturation, ventricular function, and valvular insufficiencies and stenosis, septal defect, congenital abnormalities, myocardial function. Indications. The indications for cardiac catheterizations are to confirm the suspected heart disease, including coronary artery disease, myocardial disease, to calculate intracardiac shunting and pulmonary and systemic valvular dysfunction, to measure cardiac output, to determine the location and extent of the disease process. So here to assess the stable or severe angina and responsive to medical management, and stable angina pectoris, uncontrolled heart failure, and ventricular dysarrhythmias or cardiogenic shock. So this is all associated with acute myocardial infarction, papillary muscle dysfunction, and ventricular aneurysm or septal perforations. And to determine the best therapeutic option. What is PTCA? So percutaneous transluminal coronary angioplasty, and also the stents and CABG, coronary artery bypass graft. So this is all to evaluate effect and medical or invasive treatment. Contraindication. The first one is uncontrolled hypertension, severe anemia, ventricular fibrillations like uncontrolled rhythm disturbances, acute stroke like a transient ischemic attack, GI bleeds, and allergy to contrast with a dimedium, and renal failure or any renal dysfunction, uncompensated congestive cardiac failure, and fever, the persons with active infections or any febrile illness, electrolyte imbalance, and severe coagulopathy. So who's having the problems with the blood coagulations? Coming to the sterile field and patient. The technologist working with the cardiologist must be scrapped in following basic sterile surgical technique. Then the patient will be trapped from neck to down with the sterile traps. After that, all the equipments like radiation shields, image transfers, equipments which is used to manipulating the machines, and this is all must be trapped with sterile covers. What are the sterile equipments needed during the cardiac catheterization? Procedures tray should include sterile gowns and gloves, which is for scrub tech and doctor, sterile towels and trapeses for procedure, and equipments covers, gauze, scalpels, needles, scissors, and comatodes, and syringes for heparin and saline flushing, and lidocaine and blood draws, labels with marking the pan for any items filled with the solution, and basin for heparin and saline mixture, and one more basin for waste fluid, and the small cap for lidocaine and skin preparation solution, and high power manifold connection tubing. Medications used. What type of medications used during the procedure? The patient relaxed with burst or fentanyl, sometimes both medications to be administered, and two 500 ml bags of saline infused with 2000 units 2 cc heparin each for flushing all tubings and catheters and sheets, and the lidocaine for tissue numbing and Visipex contrast unless otherwise the specified condition. Arterial puncture. The best access is easiest from right side of the patient due to aortic band. The puncture is generally done via the femoral artery. Alternative sites including the radial and brachial arteries of the both arms. Steps to insert the catheter. After numbing the groin area, the femoral artery is palpated and the needle is inserted in that direction. When blood comes out of the needle, the artery has been accessed. A small flexible guide wire is then inserted into the lumen of the needle, and the needle can be removed, but the wire must be maintained the position. After removing the needle, a flexible plastic tube can be placed over the wire and introduced into the artery. This is called one-way sheath, which means allows the insertion of the catheters and wires without the blood escaping. Then the catheter is inserted over the guide wire but through the sheath and advanced into the placement via the inferior vena cava to the aorta. Coming to the catheter placement. The movement of the catheter is monitored under the fluoroscopy, with the doctor's cardiologist manipulating its movements, and the fluoroscopic machine is manipulated by the qualified and scrapped radiological technologist. When the catheter is in place, wire can be removed and contrast administered. So you can see the picture. Here the aortogram used to assess ascending and descending aorta. So first of all, we should know about what is fluoroscopic machine. The X-ray machine is suspended from the ceiling. So it can be manipulated in multiple angles and used to achieve a desired pictures. The X-ray comes from the bottom of the machine and the images transfers that transmit the images is above the patient. Lead shieldings and the radiation batches is required for all the personnel in the room during the procedures. Finished procedure. After the procedure, the completed when the cardiologist has seen all the views and anatomy decides and all pressures recorded. After that, the catheter can be removed and manual pressure must be applied to entry site for 15 minutes. After the procedures, what are the instructions how to give to the patient? The first one is the patient must lie flat and supine for a minimum of 2 hours to ensure the artery does not reopening. After the 2 hours, the patient can be released to persons driving the patient home. The dressing must remain dry, no lifting over 5 bounces for 3 days, and no shower for 24 hours, and no bathing or swimming for 1 to 2 weeks, and drinking the plenty of the fluids. And if you severe pain or swelling or any discolorations of limbs occurs, doctors must be notified immediately. After the study, some of the assessment to be taken. We'll see one by one. The first one is monitoring the vital signs every 50 minutes for 1 hour every 30 minutes for the next hours and every hour if stable. Then, taking the peripheral pulses, the radial pulse should be palpable and as strong as it was prior to the catheterization. The third assessment is the skin color and temperatures on both extremities, the site and comparing the circulatory alterations. And the final one is assess the site, blood leakages, if it is there, and give the apply pressures. We have some of the coronary arteriography catheters. One is Pictile, Effendorf, NIH, Lagmans, Sones, Judkin, Amprots. Coming to the nursing care. Before the procedure, we have to explain to the patient. So, first obtain the informed consent. After the patient is probably identified, the procedures must be explained before consent can be signed. And monitoring the vital signs. Baseline vital signs will be done, and as long as this or the doctor's interest can proceed with the procedure. And the blood test must be done, including blood, urine nitrogen, creatinine, PTT, INR, insulin and sugar levels. And finally, obtain the client's height and weight, which will help you for used to determine dye administration. Fluid restrictions followed by 4 to 6 hours. Here, ensure that dietary and fluid restrictions have been followed at least 4 to 6 hours before the study. And after that, medications are restricted or discontinued. So here, they ensure that the routine medications are restricted or which is allowed to permissions from the physician in order to that is for who is taking the anticoagulants medicines have been discontinued. Site should be shaved and cleansed. So here, anesthetize with the local anesthetics agents that the catheter is inserted, the sensation experience as the catheter is advanced. So after that, have to collecting the allergy history. So asking the client about any history of allergy like iodine based contrast agents. So next, to provide the hospital gowns without metallic closures. And after that, allow the client to retain the dentures, glasses and hearing aids, so which is all as they do not interfere with the study. Obtaining the baseline pulse, blood pressure, ECG and peripheral pulses, which is all mark the sites of peripheral pulses for comparisons of after the study. And after that, administering a sedative or anti-anxiety agents such as diazepam, so another name is Valium, or both types of medications and analgesics such as mebriptine, other name is the Demerol. So this is all medications ordered before the procedures 30 minutes to 1 hour we have to give. Initiate an intravenous line to administer fluid and medications. So this is all needed during the procedures. Have the client wait before the procedures and obtain the history of suspected of known cardiac conditions like any cardiovascular status or any cardiac medications like allergies to iodine and previous test and any procedures. Place the patients in the supine position on the tilt top table and secured by the restraints. An ECG leads to be placement for continuous monitoring. The patient may be asked to cough or deep breathing. And monitoring the patient's heart rate and rhythm, respiratory and pulse rates and blood pressure, which is all frequently during the procedures we have to monitor. Let's see what are the equipments required for during the cardiac catheterization. So the following equipments and associated supplies be on hand when performing cardiac catheterization to treat ventricular arrhythmias or other complications. So we'll see one by one. One is resuscitation bag, oxygen, suction, oximetric device, endotracheal tube and defibrillator, monitoring for pulse and blood pressure, ECG, external pulse pacemaker, medications such as iodine, betaline, and epinephrine, atropine, morphine, and isopretinol. Extend the extremity used and immobilize it with a stand back and encourage the movements of the unaffected extremities and schedule the post procedures ECG and future sutures removal from the incision site, and after that observe for complications of cardiac catheterization. Extend the extremity used and immobilize it with a stand back and encourage the movements of the unaffected extremities and schedule the post procedures ECG and future sutures removal from the incision site, and after that observe for complications of cardiac catheterization. After that, if the patient is having any complaints of pain and discomfort at the incision site and chest pain and nausea and feelings of light headache should be reported, because the contrast medium acts as an osmotic diuretic and monitoring the urine output and ensure that the client receives sufficient oral and IV fluids for adequate excretions of the medium. Pain medications for incision site and back discomfort may be given as prescribed. Neurological changes such as visual disturbances, slurred speech, swallowing difficulties, and extremity weakness should also be reported. Coming to the complications. So what are the complications we can see after the cardiac catheterization? The first one is allergic reaction, so which is to contrast media, dysarrhythmias and bleeding, so which is from the puncture site, and atrial thrombosis, stroke, and perforations of the heart or intrathoracic grade vessels, and myocardial infarction, and pyrogen reaction, and infections and death. So finally, coming to the discharge instructions. So for the patients being discharged in the hospital on the same day as the procedures, and instructions are provided for self-care. The first one is for the next 24 hours, do not bend at the waist if lift anything, strains or lift heavy objects, and avoid dub baths but shower as desired. And talk with the physicians about when to return to work and derive or resume strenuous activities. Then call physicians if you have bleeding, swelling, bruisings, pain from the procedure's puncture site, and temperatures of 38.6 degrees Celsius if occurs. If test results showed coronary artery disease, talk with physicians about treatment and rehabilitation programs, and talk with the physicians or nurse about lifestyle changes to reduce the further heart problems. That's today. Hope you liked this video. Thanks for watching.